Hi, my name's JC. I'm going to be doing my IV med push and then my IV piggyback skills video. To begin, I'm going to go ahead and follow my GPSP. I'm doing my 11 rights of medication. I'm doing my 3 med checks. I'm always doing my 2 patient identifiers, and I'm doing my assessing for any allergies. So first, I want to do my first med check. Lasix, 40 milligrams. This is my MAR. I'm just checking it. Okay. Now I'm going to go ahead and pull my med and check it against the MAR. All right, that's perfect. Now I'm coming into the room. Hi, my name's JC. I'm going to be your nurse. If I could just get your name and date of birth. Okay, perfect. Checking the band. Perfect. And it matches. That's my 3rd med check. Do you have any allergies I need to know about? They don't. So I'm going to go ahead and I'm going to put my my hand hygiene, or do my hand hygiene and put my gloves on. I had gloves, but they got ripped, so I got my gloves. And I'm just going to go ahead and I'm checking the site for any complications. And there's none, so we're good. So now I'm going to get my alcohol pad, and I'm going port closest to my my patient. I'm sorry, gosh. And I'm just administering, this is just my normal saline to flush the line first. I'm maintaining asepsis during this. I'll let that air dry. I'm gonna go ahead and I'm going to aspirate, make sure there's blood return. There is, so I'm pushing it slowly. I'm gonna do it over about a minute. And that's good. Dispose of this properly. I'll get a new swab or alcohol pad. I'm cleaning the port again, and I'm letting it air dry. Now here's my Lasix, 40 milligrams. I'm gonna make sure I maintain my asepsis during this. And I'm just checking the site, especially during the flushing. I'm checking for any signs of complication at the IV site. I'm just attaching this after it's air dried. And it's Lasix, 40 milligrams. I'm administering it at the rate prescribed, and I'm going slowly, checking the site for any complications. And we're good. I'm going to dispose this properly. I'm getting another clean alcohol pad, and I'm cleaning this port, letting it air dry. And this is just my normal saline. Maintain your asepsis during this and dispose this properly. I'm going in and I'm going to push it at the same rate that you push the medication, because there's still medication in the line, so you want to do it slowly. Just checking my site. Looks good. And dispose of this properly. I'm cleaning my side again. And I'm getting a new disinfectant cap. And I'm just going to, once that's air dry, I'm going to go ahead and put that on. And the whole time, I'm just going to go ahead and make sure I'm assessing my site, making sure there's no complications. I'm going to go document my medication administration immediately, and I'm going to come back and evaluate my patient's response. When I go out, I see I have an IV piggyback for cefotaxime. I know I'm butchering that, so I'm just going to go ahead and I'm following my 11 rights, and I'm doing my 3 med checks. I'm going to come in. Can I just get your name and date of birth? Perfect. Perfect. That matches. Is there any allergies I need to know about? There's not. I would just check that allergy band if they have one. I'm going to do any necessary assessments, and now I want to go ahead and make sure I check the compatibility of the IV medication, the prescribed medication. I want to do my diluent and the IV fluids that are already being infused. So that's all good. I'm going to go ahead and perform my hand hygiene, put my gloves on if needed. I'm checking the site just for any signs of any complications. There's none. So I'm going to go ahead and get everything ready to do my piggyback. And do I have all my stuff? I've got this. And I'm gonna just go ahead and make this a little bit easier on myself and hang it up. And I need to get my bag and get ready to spike it. So I'm maintaining my asepsis during this. I'm gonna dispose of this properly. And I'm gonna spike my bag and make sure, like I said, we're maintaining asepsis. I'm making sure my clamp is closed, and this needs to be at the highest, hung the highest, and this is going to be hung down here for the gravity. This is my makeshift IV stand, so, or IV pole, so just bear with me. Now I'm going to go ahead and prime my line. I would make sure this is at halfway. And I'm just making sure that I prime my bag, or my line, and I'm closing my clamp. I'm gonna go ahead and put this back on. Now I'm gonna go ahead and get ready. I'm gonna get my antimicrobial swab, and we're going to the IV port. It's a little hard to see at my IV port closest to my bag. I don't know if you can see my bag down here. And I'm just gonna go ahead and I'm cleaning this really good to make sure that I can attach my new medication. So I'm gonna dispose of this. And I'm gonna get ready to attach. I'm just going to dispose of this properly. And I'm going to go ahead and I'm going to set it at the rate it's been prescribed. So that's 1 gram over 30 minutes. I'm checking my MAR. And I'm going to go ahead and that's set. So I'm opening my clamp. I'm just going to check the site before I go and make sure it looks good. Looks great. Patient doesn't seem to be having any issues right now. I'm going to let this go ahead and start. I'm going to come back and check the infusion periodically. At periodic intervals, and I come back, it's done. So I'm going to go ahead and get ready to discontinue it. So we're closing the clamp. The IV site looks good. Patient's not having any issues. I'm going to use my swab to clean the port. And then I'm going to take a disinfectant cap and I want to put it back on. I'm going to discontinue this and dispose of it properly. And now I'm just going to go ahead and hang my bag back up where it was at the height it was before. And I just want to check the flow rate for this and make sure it's still at the prescribed rate. It is. Everything looks good. Site looks good. I'm going to go ahead and document. I perform hand hygiene. Make sure the patient doesn't need anything else. I'm going to go ahead and document the medication administration immediately. And I'm going to come back and evaluate my patient's response. Thank you.